Hi, everyone. I'd like to welcome Dr. Siri. Dr. Siri, it's an honor to have you here on Ride to Independence.
Thank you.
How
Thank
are
you, Trish.
you?
Thank you. I am good. Good day today
Okay,
in
great.
New Jersey.
Yes,
Yeah, great weather.
good. I'm glad you're great. So, Dr. Siri, let's get down to business. What is the difference between dementia and normal aging?
Okay, so dementia is basically a syndrome of symptoms and signs, and it actually affects your functioning. It affects your mood. It causes you to have memory loss, your thinking skills, your executive functioning, and it actually affects how you function, your day to day. Whether you're preparing a dinner for 20 people, right from the start of planning to, how to lay the setup of your home, preparing the meal, everything, how
Mhm.
much you're going to buy. You're not going to be able to do it if you have dementia. Whereas normal aging, when we have, it's basically you are forgetful. You might forget names, you might forget events, but it is not affecting your functioning. You can still do
Mhm.
your banking, you can still plan, you can still drive, you
Right.
can still go to work. Yeah, that is the difference, biggest difference.
Okay. So are there any what are the beginning signs? Is there any type of beginning signs that people should be looking for?
Yeah, so I think the first thing that we actually forget is mood disturbances that really happen with patients
Okay.
who have are developing dementia. So apathy sometimes is really the first sign. We might think it is depression, somebody's not as involved in an activity, or they are not going out as much, or they used to be very social and they're not doing their social activities as much. When you have depression, you could have something similar. You might have apathy also with depression. But in patients with depression, that really bothers them. That apathy bothers them. You're right. It is really affecting them inside that they are not as social or they are not able to do things and that nothing bothers them. With patients with dementia, it doesn't bother them. The apathy doesn't bother them. You know, they really couldn't care less if they were socializing. They couldn't care less if somebody was around, or so that apathy is usually one of the first signs. And that progresses on to cognitive deficits where, your thinking skills are, your language gets affected. And then, we do see their functioning, day-to-day functioning, their driving gets affected. They're not able to function in their workplace. They are not able to do their banking or their taxes, or they're missing paying
Right.
bills. And then, they also get behavioral disturbances, neuropsychiatric complications eventually. And then the end stages is where their motor and sensory function is affected. They're not able to walk as well. They're falling a lot. Their balance is off. They are
Oh my
incontinent
goodness. Yeah.
and
Yeah.
things like that. So that is through this different stages of dementia.
Well, where does the angry stage come in? All
So,
of a sudden they're angry.
so you know, there's a couple of things that we interpret as anger, but it is, when they are during their mild stages, when they're actually having apathy, they're really not
Okay.
concerned about it. And we keep forcing them to do things that they couldn't care about. That is, when they feel like
Okay.
people are trying to control them, that is where the anger comes in. But in the later stages, where really the neuropsychiatric complications are developing as the disease is progressing, that is another stage where they get very angry, agitated. The behavioral
Yeah.
symptoms we see, and their paranoia and things like that.
Yeah. Exactly. Exactly.
Yeah.
So then when do you bring up the cognitive concerns with these patients? I mean, or their families?
So you know
When
what?
do you bring up that
Yeah,
concern?
a lot. I've seen a real swing in the pendulum right now. Initially, when I was doing memory screenings, patients didn't want to know about it. Nobody wanted to talk about it. It was such a hush hush topic. It was like,
Yeah.
The family
Yeah.
didn't want to bring it up. The patients didn't want to bring it up. I had to be the one bringing it up. And now I think
Yeah. Yeah.
with the education and a lot of families are bringing it up, and sometimes they don't want to have that conversation with their loved one, so they will bring it up to us and we'll, encourage the patient to go through testing and then we'll talk to them about it. And I always encourage families, you should really be their daughter or their son or their brother and sister. Let the physicians handle the conversation because it is a very difficult conversation. Emotionally,
Right,
very
because you don't yeah, yeah.
exactly. It's a very emotionally
Exactly,
yeah,
'cause yeah, because you don't want the parent being upset with the
that's
child.
correct.
I did come across that. I did come across that with one of my clients, as you know, I have a
Yes.
senior concierge service, and I deal with seniors,
Yes.
and I encounter
Yes.
a situation where the daughter had to call me and bring me in, and the mother was just, oh my god,
Yes.
she was just so beside herself. You can see the venom
Yes.
spewing out of her for her daughter,
Yes.
who,
Yes.
by the way, just had a baby,
Yes.
and she's dealing with her own life and situation, and just, uh, the anger coming out of her and the disdain for her
That's
daughter
so true.
because she put her in this situation, taking her car away, and I don't think she realized the stage of dementia she was in. I
Yeah.
think that seems to be a big issue with these people.
Yeah.
They don't realize the stage of dementia that they're in.
I mean,
Talk on that.
that is the problem with dementia. Yeah. So the problem with dementia is like you do lack insight, and you will make some poor judgments as the disease progresses. And, you know, the worried well, they come in and they're like, I have a problem with memory. I can't remember names. But then that is that population worried well. But most of the times when people really are have dementia, they will say, "I have no problem with memory. I'm fine." Because they don't know that insight is completely gone. Their abstract
Mm,
thinking is gone. So they don't see. And like I said, they have apathy. So anything happening around them doesn't bother them. They don't they will say they know that if you're driving a car, you can get into an accident, but they cannot understand that they can also themselves can get into an accident if something like this happens. They'll tell you, no, I've been driving for so many years. There is nothing wrong with
right,
me. I can drive. I've done it for 60 years. I can continue to drive.
right,
And despite you telling them, this bender happened, or you've lost your way, or, that you were nearly in an accident, or those things don't matter to them. They cannot connect the dots and say, okay, you know what? I'm going to reason it out. I'm going to stop. A lot of times that does
right.
happen as they have progressed in their
Yeah,
illness. So I always say to the families, let me do the hard conversation. You continue to be their sister, or their child, or
right,
their friend, or whoever is bringing them in. And because you also don't want to label somebody prematurely, because we do have reversible causes and there are things that mimic dementia as well, so you don't want to label somebody prematurely. And so it really needs a lot of investigation, like a full history, full physical, looking into reversible causes. What other things could be impacting? Is it their medications? Is it really other comorbid conditions that are impacting them? So there's
yeah,
a lot of stuff that could be happening, alcohol, um, you know, people who've had psychiatric illnesses growing up, which were not, taken care of or not really treated well, they can, cause a memory and cognitive decline. So you really want to have a proper diagnosis before you go in and say,
right,
somebody's restricted
right.
from doing something. Yeah.
Well, how do you test for, diagnosed dementia? How do you test for that?
So, you know what? We How we do it is, in our practice, we actually have an annual mini cognitive screen that we run on every patient that comes for their annual exam. So we do that. And that actually guides us and lets us know, this is somebody we need to pay attention to. This is somebody who in the future could have a problem, or this person is really actually having a problem right now. And that once I see that, and it's a very objective test, patients are very engaged in that test. Um, so if I see deficits, I will usually tell them, and I'll go and talk and I'll tell them that we need to do further testing. And a lot of times I will review their medications at the same time and I'll tell them, this one could be impacting it. Let's look for thyroid, maybe hypothyroidism is happening, or there is a B12 deficiency, or there is folate deficiency, or are we doing a little too much of alcohol? Are we doing a little too much of illegal drugs? Do we have underlying anxiety and depression that is not treated? Are we doing too much of benzodiazepines or narcotics? They all have an impact on how your cognition is, and they can have similar signs and
Oh,
symptoms. So you want to exclude
I
all of
see,
those.
right.
And then, a lot of people at that age are using medications for urinary incontinence, right? So your ditropans and detrols, they also have anticholinergic side effects. They can also impact your cognition and memory. Hearing loss is a big part of it, right? When you have hearing loss, people tend to withdraw and they don't want to have conversations, and they might appear like it is actually uh dementia. The people who can, but hearing loss is another risk factor for patients to have dementia because not untreated hearing loss.
Mm,
People with Parkinson's will eventually have some kind of cognitive losses. A lot of the other neurological
mm.
disorders will also have cognitive losses in them. So you really do want to have a comprehensive evaluation. You could have untreated hypertension, diabetes, mini strokes on the scans that could be contributing to their cognitive losses as well. So a lot of factors that impact your diagnosis. So it's not a one and done. It's a series of, evaluations that you do, and then you eventually make the diagnosis.
I forgot to ask you what type of practice you have, but what kind of doctor needs to be seeked out for this type of testing? Not a regular MD does not do this type of testing.
So I'll tell you that, lot of doctors do, but they might not have a follow up to that. So, the screening really sits with the primary care. And I would really emphasize
Oh,
that
okay,
your family doctor or your, primary care
okay,
physician should be able to screen with a mini cog. It takes less than 3 minutes to do that test. And if you do it on your annual, it is a very good indicator of where, this person could be. And yes, a lot of
right.
doctors.
But what age though? But what age? Because my husband or other people I know went in for their annuals at 65. They didn't mention anything about getting that type of test. So what age so should we be asking possibly for that
Okay,
test?
so I think if they didn't get it at 65, I think there was a miss. But I think mini cog is a part of an annual wellness visit that Medicare
Okay.
allows you. So one free visit that Medicare allows you every year is an annual wellness visit, and that you should be having a mini cog. There's no questions about it. It's a
Okay.
requirement as part of that visit. Um,
Okay. All right.
yeah.
So it's a mini cognitive
Yes,
test.
it's a
Okay.
mini cog, and it tells a mini cognitive test. Yes, I'm sorry, and it's called mini cog, but it is, it tells you a lot about the patient actually. So,
Okay.
uh, if there are a lot of doctors who are not comfortable going beyond that test. So then, they can refer to a neuropsychologist, they can refer to a neurologist,
Okay.
they can refer to a geriatrician. It sits with all those three fields, actually. And,
Okay.
but it is, again, when you're telling your patients it's an abnormal test, you do need to have some kind of connotation. It's the same thing if you have an abnormal CAT scan or you have an abnormal blood test. You really need to be able to explain to the patient what is your next step? Why are you doing the next step? What are the risks and benefits of doing the next step? Because there is a lot of anxiety around this, right? I mean, a lot of
Right. Oh,
there is
sure.
lot of social media attention, but there is also a lack of knowledge, and so it does raise their anxiety levels. And some people will say, "I'm not doing anything about it," but there is a reason that we now say that you should be really doing something about it. I can say up to 2 years ago, we didn't have a lot of treatment options, and we didn't have a lot of research options that were available to the communities. But now we do. We have both, right? So, and then early diagnosis can actually help them get into research studies that can help them get medications actually to help delay the onset of the disease, um,
Okay.
and or get symptomatic treatment if they already have the disease. And then we have to understand that the community needs to know that CMS rolled out a very good program. It's called the Guide program. And the people who are living with dementia, the families who are living with dementia, do need to enroll in the Guide program. But if you don't have a diagnosis, you can't enroll in the program. It's a
Right,
true
right,
benefit to the
right,
patient and the caregivers.
right. You mentioned CMS. Who is
Okay,
CMS?
I'm sorry. It's Center for Medicare and Medicaid Services. Yes. It's
Okay.
yes.
Okay. So everybody who's 65 and starting to receive Medicare should be getting a mini pod, which is
Absolutely.
really a mini cognitive
Test.
test.
Mhm.
Okay. Okay, so people just be aware of that,
Yes.
that at 65 you should be getting this test. So tell me, what are the common types of dementia?
So, dementia is basically just like a top of the umbrella, and then you have a lot of different things that are going on. The most common dementia that we see is Alzheimer's. And, yes,
Okay, yeah.
so the most common is the Alzheimer's, and everybody is afraid of the name.
Yes.
You'll tell some patients,
Yes.
I tell them that, I think your mom or dad has dementia. They'll say, "I hope it's not Alzheimer's." Well, so but it is the and the
Yeah.
reason we wanna differentiate is because the treatments are different, right? So,
Oh,
the
okay.
diagnosis is different, and again, like, up until 2 years ago, a lot of people didn't care because unfortunately, as the disease progresses, the end looks the same for all of them. But in the beginning is where we can have an impact, right? When we are talking about normal aging, when we are talking about mild cognitive impairment, where you have some subjective or objective memory losses, but it is not impacting how you do your work. You can still work, you can still drive, you can still run your bills, you can still continue to pay your taxes. You know exactly what is going on in your life and you're able to manage it. And then we come to dementia, the mild, moderate, or severe stages. And so in moderate to severe stages, most of them look very similar. Like, the decline is pretty much the same. In Alzheimer's, we have more of the apathy, the cognitive symptoms in the beginning, and then you have the functional decline, and then you'll see the mobility decline towards the end of the disease. Whereas in Lewy body dementia, which is another kind of dementia, you have your neuropsychiatric symptoms of hallucinations and lack of mobility go hand in hand throughout the disease trajectory.
Mm,
Then we have frontotemporal dementia, which is, seen in the younger population a lot, and it is mostly psychiatric. They'll have apathy, depression, mood disturbances, and behavioral disturbances a lot. Then we have, primary progressive aphasia, which is another kind, but your language and your speaking skills are affected more. And then as it progresses down, there is also people who are getting late stage dementia can also have underlying vascular dementia going on. And that's where, and then, people with vascular dementia will get superimposed Alzheimer's. And that's what we call mixed dementia. But vascular is when you have had uncontrolled hypertension, uncontrolled diabetes, cholesterol, and, those have impacted and caused you to have mini strokes or a major
mm.
stroke, and you lost brain function over the years, that also can cause and present as vascular dementia. So, several classes.
Yeah. Yes.
In the beginning, they all are very different, and we really do want to differentiate because we have now so much research in Alzheimer's. And now we are talking about people who tend to have, what the pathology that we see for Alzheimer's, and we are able to detect it much earlier. And we can intervene much earlier with medications to delay the onset of the disease.
Mhm, mhm. Well, my mother died of
I'm sorry.
Alzheimer's, and, I wasn't with her, thank you. I wasn't, but thank you for, giving us the different types of diagnose of dementia, because it's important that people know what the different types are so they can look for those things.
Absolutely.
My mother died of Alzheimer's. I was not with her, or in the same state with her, but my other family members were. So I really was not aware of her condition of the Alzheimer's, and and she did have it for 2 years,
Mhm.
and it got, pretty severe where she didn't even know how to feed herself.
Mhm.
So she was at the last stages, I believe,
That's
with the
correct.
tube,
That's
right, with the
correct.
straw.
That's correct.
He was just that she, because she couldn't eat anymore,
Yes.
and then one morning, she just didn't wake up,
Which is a
which was a
blessing.
very
Which is a blessing. Which is a
blessing,
blessing.
beautiful blessing that she died that way. But the Alzheimer's was actually 2
Yeah.
years, but I'm sure there was things happening
Much
before
before. Yes.
that were not,
Dosed.
diagnosed,
Mhm.
and that's how it progressed so quickly,
Absolutely.
I feel.
Absolutely. But you know what? As we see the moderate and later stages of dementia, what happens is, family members are very good about compensating, right? So if you have a spouse or a child that you're living with for years, you'll notice that, they'll recognize mom can't drive. It's unsafe for her to drive. So I'll just drive her, right? I'm going to drive her. Oh,
Mm.
mom didn't
Right,
pay
right.
this bill. I'm just going to take over. I'll just take it over and I think she's just stressed out.
Alright.
She just retired. Maybe she just wants to have,
Or she's just old.
yeah,
She's just getting old,
yeah.
right?
So let me take
Just
this over.
getting old.
So we do have a tendency to take over things and attribute it to normal aging where it is not normal aging. And then when really when after the functional decline where you really start seeing neuropsychiatric complications of the disease is that's when you realize, oh no, my mom was fine till yesterday, but she stopped driving 5 years ago. She stopped paying her bills 5 years ago. She stopped going out grocery shopping 5 years ago. But now that she's having neuropsychiatric symptoms, that's when families get, you know, uh, upset because what happened to my mom? My mom was all right. The
Right.
but the disease
Yeah.
process was going on a long, long time ago. But as a family, because we are
Okay.
resilient and we just take over and
Right.
so we don't recognize that
Right.
those things are
Right. Don't recognize we're
yeah,
right. In denial.
exactly.
Denial.
Yes,
It's a very big factor
absolutely.
with family members because they wanna deny. But now that I know that my mom, died of Alzheimer's, we're 7 in the family, so I'm pretty sure one of us might be possibly getting it because it is genetic.
Yeah.
Clear that up for me,
Yeah.
please. It is genetic?
So there is a gene that does predispose you to getting the disease, but I can tell you that not everybody with that gene is going to get it, right? I actually have 2 94-year-old females in my practice who both have mild cognitive impairment, um, are still functional. They're 94, so imagine they're not driving, but they're functional. They do shop for themselves. One of them is a tap dancer, so fully functional, prepare their own meals, do everything for themselves. Um, but it definitely is a risk factor for them. But it truly matters how you live your life, right? So
Yes. Yes.
nutrition, sleep, physical activities, staying socially engaged, and learning something new are all very
Yeah.
important.
Yeah.
And then making sure your blood pressure is controlled, you don't have high sugars. If you do have diabetes, make sure it's controlled, making sure that you're paying attention to your cholesterol levels, and those are very important things. They're important for your heart health, but then they're equally important for your brain health, right? And for her, she
Very
used to be a
true.
tap dancer when she was young, and she took up tap dancing, when we started talking about, staying socially engaged in physical activity. She's like, I hate, gym, but I will do tap dancing. I said, oh, definitely take it over, you know,
Fantastic.
so,
Yeah.
you're learning a new routine all the time and dance when you're in a class and you're interacting with people. So there's a lot of social interaction for her. And, she has been able to keep up, even though she is a good candidate for those medications that are available now. She chooses
Right.
to stay
Right.
away and she's really very active. And she's like, that's it. So genetics definitely plays a role, but I think the your overall and how you take care of yourself and really focus on heart and brain health really helps as well.
I think so too. On my last episode, I had a 82-year-old physical personal instructor, Dr. Suri.
Yes.
He's still teaching spinning
Wow.
classes.
Okay.
He's still doing all kinds of balance classes at the
That's
club.
correct.
He's 82 years old
That's
and he's still very active. And that's something that we spoke about: eating well, moving, getting your brain
that's correct.
functioning, growing new brain cells, learn an instrument, play a piano, learn a
Language.
language,
Absolutely.
you know, get your body worked up to get blood in there. I mean, all these things we did speak about. But also, I have to mention to everybody, it could be a luck of a draw because I was a personal trainer and I still am over 40 years. I am very fit. I eat well and I exercise and I'm always functioning, every day on high capacity. And I still got cancer
Yes.
and
So,
it wasn't in my genes.
yes.
So it's the luck of a draw, people. You can do everything that, doctors tell you to do. You can stay fit. You can be healthy. You can have socialization, have a great life. Luck of the draw.
That is so true. That is so true. But I think that a lot of it has to do also with a lot of processed foods and the stress. The stress.
Oh, thank you for bringing that up. Thank you for bringing that up because when I got my cancer, 15 years ago, I kept telling the doctors, listen, I am a healthy person. It is not in, I took the BRCA test. It is not in my genes. I am telling you what gave me the cancer. This was 15 years ago. Stress, because I internalize and I eat my stress.
Yes, yes.
And how do I know that? Because when I graduated from the American Academy of Dramatic Arts, I had a big bald spot in the back of my head
Ah,
because I was internalizing the stress of graduating, the
yeah.
future. Oh my God,
Yes.
stress.
Yes, that's so true. That is so true. Yes.
So I think now they're studying stress
Yes, they are starting big
and the
time.
ties to
Uh-huh.
cancer.
Uh-huh. So I actually do tell a lot of my patients that meditation is a very good piece to add to their lifestyle. And, some people can do very well with physical activity. And when they are really focusing on physical activity and, you know, they can tune things out, when you go for a walk. And I encourage people to go outside. Gym is great. It's wonderful. But I think going
Yeah,
outside, there is something to say about the sun and something to say about the natural weather. I
right.
do encourage patients to go out. And then I also tell them, listen to music. Maybe that will get you into a meditative state. Maybe you listen to your prayers, whatever makes you tune out whatever you are doing. And then there are certain exercises, right? So you do, breathing. Boxed breathing is very good. So there are a lot of ways to get yourself to relax. And you could start with few seconds. It doesn't have to be meditating for 30 minutes for everyone,
Yeah,
right? But it
yeah.
is
Even a 5-minute walk, 5
exactly.
minutes and then grow into, 10 minutes, 15 minutes.
Yes.
But what is the connection between heart health and hearing and other health issues?
So, I mean, hearing is a big risk factor for dementia.
Okay.
Really.
I know you
Yeah.
mentioned that earlier,
And
but talk about that more.
yeah,
Yeah.
so people who have hearing loss will you will see they'll have a tendency to withdraw, right? They're part of their family gathering, but they're really not engaging, right? So we all need to keep using our brain cells, but because if you don't use them, you're gonna lose them. So
That's
they
right. Lose them or yeah, use them or lose
yeah.
them. Yeah.
So if you are part of your family gathering and you are withdrawing and you're not really participating, then eventually what happens is people stop talking or engaging you in that conversation unless and until you make a conscious effort of being part of that conversation. And you also sometimes start hating yourself for, oh my God, I have to ask them to repeat themselves constantly. Yeah, well, it's okay. But so, what I tell my patients with hearing loss, try to make your gathering small. Like, keep it to 2 to 3 people where you're able to read their lips and still have engaging conversations. A party of 20 might not be the right place for you, but please continue to have those engaging conversations because they are important. So, if you read recently, there was a study that came out that people who were having these small talks while taking a walk outside did better and did not develop as much dementia compared to people who were like really not having those conversations, right? Small
Okay.
talk
Right.
is
Right.
equally important.
Yeah.
Equally important.
Yeah. So small talk while you're walking. Well, you're doing a whole body thing there because
That's
you're
right.
moving and you're getting the blood circulating, and you're also, using your brain because you're trying to come up with questions and
This is
answers, and you're bantering back and
that's
forth.
correct.
Yeah, walking is one of the best things that people can do. It's the obviously the
Yes.
cheapest. Everyone,
Yes.
you don't have to pay for
That's
anything,
correct.
and you're getting vitamin D.
That is true.
You're also getting vitamin D,
Yes.
but, that's so true. But again, so then what are the, oh, so then what is an option for patients with some type of I've heard of fatty livers. Where does that come in?
Okay, so you know what? The same, what we talk about heart health, right? We talk about patients with diabetes, hypertension, high cholesterol, obesity, all of these. They need to have a good control over these to have a good heart. But people don't
Mhm.
recognize that people who have these risk factors also do tend to have dementia, that we talked about vascular dementia, but they also tend to have fatty liver. So fatty liver is, very common in patients with type 2 diabetes, obesity, any kind of metabolic syndrome. And it is definitely higher in certain patient populations. The the problem is that we, again, same like dementia, we didn't have a lot of treatment options a few years ago. And we did not have a lot of people were not ready to be diagnosed because we didn't have a lot to offer those patients. So there was no point in
Right.
diagnosing them because we didn't have any treatment options for them. But now we do. We have one FDA approved drug, but we have a lot of clinical trials that are going on for fatty liver disease, which we call the non-alcoholic, liver disease, or the cirrhosis that people used to call alcoholic related cirrhosis. But this is
Right.
truly metabolic, cirrhosis. So, which is non-alcoholic. We used to call it non-alcoholic, but it is truly metabolic associated liver disease. And there is a lot of clinical trials in that. uh, so if you see at my back, we have the CRCNJ. I'm going to call them out. I'm actually the principal investigator for a lot of these NASH trials, the non-alcoholic liver disease trials, and for the Alzheimer's. So we are truly looking for patients, with mild cognitive impairment, normal aging, who think they're having normal aging at risk for Alzheimer's, or mild
Mhm. Mhm.
disease
Right.
for dementia, and to get them into trials so that we can really delay the onset of the disease, and delay the onset of
Right.
the later stages of the disease, where most of the morbidity happens. And for the liver, we are really doing stage 2 and 3 liver disease, where we can see if we can reverse that liver disease so that they do not get on to the end stage liver disease cirrhosis.
Well, what are the steps that people can take,
Uh,
with the memory concerns in these clinical trials?
So the first thing is to reach out, right? So
Yeah,
we will share with you our contact information, and then
right.
that I think they can reach out to us. There is a Facebook group that they can join. Call us. We are doing free memory screenings for everybody. We do also do free fiber scan for liver disease. So anybody who thinks has hypertension, obstructive sleep apnea, hyperlipidemia, obesity, type 2 diabetes, we are offering them a free fiber scan at the Ridgewood and the Springfield location. And we are also offering free memory screenings for anyone who's interested at both the locations.
Yeah, very, very good information. I will link all your information, Dr. Siri,
Sure.
about the Clinical Research
Sure.
Center in Ridgewood. I will link that in my notes. I also want to link your information. I
Sure.
believe you've been in practice. You're in practice in Englewood, New
That's
Jersey.
correct.
So you can also reach out to Dr. Siri. So I will link all that information. Dr. Siri, thank you so
You're
much for
welcome,
coming
Trish. Thank
on.
you so much for
You
having
gave
us.
us so much wonderful information. I appreciate you. Again, people, everything will be linked in the notes for Dr. Siri and also the Clinical Research Center in Ridgewood. These are free clinical
Thanks.
testing, Dr.
Absolutely.
Siri.
Absolutely. They're free.
So there's no
No
excuse.
excuse.
No excuse for everybody should be coming in and getting
Yeah.
tested. And we did mention that we should be starting the testing, what, at 65,
You know,
maybe 62?
I would say that if you think you have subjective symptoms that you're forgetful, or you think you're forgetful, or somebody's telling you that you've been forgetting, or you're asking somebody again and again for the same information, I would encourage you to get tested no matter what age. But
Okay.
yes, 65 and above, there is a free screening that is done by your primary care physician. So,
Yes, we talked about that. That's the mini
many
cog.
cog.
The mini cog, which is a mini cognitive center.
That's good.
But if you want to go into the research
Yes,
center, the clinical research center in Ridgewood, that is free. That is something that is
absolutely.
offered by the
Mhm.
government. It's federally funded. So I would mention to everybody, please get yourself tested. If and don't forget when you have your physical, if they don't give you that mini cog, ask for it. Now that I know that, that's so wonderful. I'm gonna make sure and mention that to all my relatives.
And you know what?
So
I would
Dr.
also
Siri,
say that
yes.
every patient now with diabetes, elevated BMI, hypertension, cholesterol, should be asking their primary cares for a fiber scan, because fiber scan is
Okay.
also a screening tool, right? It is a screening tool for liver disease. Yeah.
Okay, excellent, excellent. Well, Dr. Siri, thanks again. You have a great day. Thank you,
Thank
everybody,
you.
for tuning in to Ride to Independence. You're welcome.